Hi, Dr. Anuj. How are you?
Hello, I'm very good, thank you. And how are you doing, doctor?
I am very good. I'm very good. And on behalf of the team of Unearth Wellbeing, I welcome you on our channel. And, as a colleague, we have shared a great work relationship in the past. And I'm so happy to have you contributing to our channel and spreading well-being. And for our viewers, let me introduce you. This is Dr. Anuj Kakkad, and he is a practicing MD physician. For the last 3 years, he has been practicing. And during this phase, he was privileged to be able to serve in both the private and government health sector in healthcare hospitals. He has been awarded the COVID Warrior for his contribution during the pandemic, and he is currently working towards pursuing neurology residency from the United States. Very soon, he would be moving to United States, and his areas of expertise are preventive medicine, the heart health, stroke, dementia, and diabetes. Right, Dr. Anuj?
Yes, yes, correct.
So it's been really good to see you on screen after so long as well for me. And
Likewise.
let's start. Let's start with the session now. Okay,
Yes,
great.
yes.
So, Doctor, today we have invited you to, throw some light on the various heart conditions. I'm sure most of our viewers are would be interested in knowing about this because I think heart ailments are one of the commonest, causes of many deaths in the country, in the nation, and I think every other family has got some or the other person with a heart ailment.
Correct.
So we would like you to start off giving us some background about heart ailments and heart diseases. What is this heart all about, and what is this that we need to keep in mind about this?
Yes, yes, sure, sure. First of all, thank you for the lovely interview, and it's really being pleasure to be here and connect with your audience. So, about heart. So, heart is basically a very, very wide topic, and multiple types of conditions are affecting our heart. So, talking about the general structure, first of all, what is heart? So heart is basically a muscle. It's something which is a specific muscle for the heart. So for the heart, the muscle of the heart or the heart is itself a muscle. Its main role is to pump. So what does it pump? It pumps blood. So its
Correct.
major role is to pump blood to the entire body. That's the one of the biggest function which it plays. So pumping the blood, I'll share you one interesting fact about the heart. So
Mhm.
we all know that our heart beats about 70 to 70 72 minutes, 72 times per minute, approximately for a normal human being, adult human being. But when you calculate it, when you see how hard and fast it's working for so long, so in the entire day, if you see, it's beating for more than 1 lakh times. So just
Mm.
imagine how much energy, how much power it has. And in that 1 lakh times, in the entire span of day, it is pumping 10,000 liters of blood. Just imagine
Oh
if
my
you
God.
just yes, you just imagine when you put it in the one day perspective, you can see how versatile it is, how powerful it is. So it's a very powerful organ. And even if our engineer friends or maybe somebody from technical background, if they think about a motor, just a normal electric motor or a fuel motor, you can see how much energy it would need to pump 10,000 liters of blood. So this is one interesting fact which I would like to share. And the other thing is the ailments. So, talking about the ailments, as you said, heart disease is very common. And being very common, I would also say that it is the one of the most common cause of known cause of death in the entire world. So, in the common our world, it's a very most common cause of death. So, around we can say approximately the WHO study says 32% of the population have been died. So the total number of deaths are due to 32% of the total number of deaths are due to heart condition. So being said heart condition, talking about the heart illnesses. Now the further step I would like to take is uh, heart is basically a mixture of muscle and blood vessels. So we cannot separate the blood system from the heart because it's the major role of the heart. So
Right.
when we say number one person cause of death is heart, then we have to consider it is a basically heart and blood vessel disease. So that is why
Mm.
in our medical terminology we call it as cardiovascular disease. So
Right.
cardiovascular disease, CVD. So these are the number one cause of death. So this could be directly related to heart or it could be related to blood vessels. So it was just an overview to give an
Mm.
overview that when we call it heart, so we are just talking about the number one cause of death, which is the heart disease, and it is basically linked with your blood vessels. So cardiovascular disease, so heart and blood vessels. So that is just a brief about my from my side.
Okay, okay. Thank you, doctor. So, doctor, what do you think could be the root cause of such heart problem? Why is it that the percentage is increasing every year and every day?
Mhm. Correct. So, as we are talking about the heart illness, so the cause, it is multifactorial. So we cannot link
Mm-hmm.
it to one single cause. So that is why heart disease is considered a multifactorial disease. So you cannot relate it only to a single genetic cause, familial cause, age, or maybe any smoking history or diabetes. All these together are contributing to your heart disease. So talking about the cardiovascular disease, so number one in that is basically your coronary artery disease. So basically, what is happening here in this disease is the risk factors, which uh, it is a good chance for me to give brief about the risk factors, so we can consider what are the risk factors which are causing the heart disease. So uh, we can broadly divide them into modifiable, non-modifiable. So what I mean by modifiable is that you have some control over it. You can
Correct.
basically overcome it. So for
Mm-hmm.
example, our stress, our anxiety, all these things comes under one category. The other one would be your smoking history, your
Mm-hmm.
hypertension, your diabetes, your cholesterol levels, your over consumption of alcohol. So all these are
Mm-hmm.
considered modifiable. And there is a small aspect, or we can say an important aspect of the risk factors that would be non-modifiable. So in non-modifiable, we will highlight 3 to 4 things. That is your age. With age,
Mm-hmm.
we have seen that people have been suffering from heart disease. So one is age. Second is your sex. So males in general are are at more risk than compared to the females. Then we would have age, sex, gender uh, gender, the same thing, sorry. And
Correct.
the third one I would like to call is ethnicity. So people with
Mm-hmm.
different ethnicities have been linked, that for example the blacks have been more in general being exposed. And the other fourth
Mm-hmm.
one is family history. So if you have somebody in your family, your father, your brother, your elder one, or somebody from your mother's side who has suffered from
Mm-hmm.
heart disease, you are slightly at risk. So being
Correct.
telling about the family history, so it is not only the genetic component which is coming at risk. Genetic wise, we don't have any particular direct relation, but family history just says that in your family, you are more prone. It could be the environmental where you live, it could be the water you drink, it could be the surrounding structure of your house, your behavior, your overall family mentality, or the stress level in your family. So it could be anything. But in general,
Mm-hmm.
if somebody in your family has a heart condition, you are more likely to suffer from it. So this is just brief about the risk factors involved for heart disease.
Correct, correct. So, doctor, can we say that these heart problems are hereditary, and how much percentage of people do you feel are really, falling in this category? Because now, with all the other risk factors, anyways, it is running in the family. So, is that and hereditary the same, or is it different?
Yes, it's a very good question though, and it confuses even the students and the doctors as well, and in general population. So, talking about the family history or the hereditary part or the genetic component, it's
Mhm.
always a topic of controversy or research. I would say it research. So, hereditary, when we say hereditary, we say that we have some sort of uh, confirmation that we have a gene or we have some isolation of a particular DNA segment or your germ material from your father forefather, which
Mhm.
is basically proposing that risk in you. But in
Mm-hmm.
case of heart disease, it is very, very less. So it's not that the hereditary component which is being transferred is causing you more harm, but it is in
Mm-hmm.
general family environment, which was you were brought up, the way you eat, the way you live, the way you are exposed to different toxins in the environment, the pollution. So it is more of the hereditary component, but it is more of the familial component, but not of the hereditary genetic component. But there is. So it's a very less probability, but the majority of the part which is affecting is your familial part. It's not your hereditary part or the genetic part. There are certain genetic conditions which make you prone to heart disease, such as familial hypercholesterolemia, familial
Mm-hmm.
hypertrophic cardiomyopathy. These are the some in general terms we correlate with heart diseases. This can basically increase your heart disease because of some genetic cause. But in general, we can say it is a familial cause, not a genetic cause.
Okay, okay. That was really wonderful to know that. So, my next doubt here is, Doctor, could you please share what could be the early signs and symptoms of someone, having a heart affection or probability of getting a heart affection, so that, we can be alert that yes, we are probably going in that direction. So, could you
Mhm.
please throw some light on the early signs and symptoms?
Yes. So one important we all know is chest pain. So it could be a mild chest pain, it could be a moderate, it could be severe, depending on the severity of the blockage what you have. So
Mm-hmm.
chest pain is the most common presentation what we see in the patients coming to the emergency department. Then the second is basically the other important fact before chest pain I would like to cover is some can be asymptomatic as well. So majority of the population, their initial part, they can be part of a presentation where it could be asymptomatic. It might take time
Okay.
for them to develop some symptoms. So,
Mm-hmm.
in general, what we have found is considering coronary artery disease, which is the number one cause of the heart disease. So,
Mm-hmm.
in that you have blockages. So, blockage is basically nothing. The blood vessels are being blocked with some kind of dirt inside. It could be cholesterol, sugar, damages from various toxins, whatever it is. So that
Correct.
blockage, when crosses 70% of the blockage, and it causes, sorry, more than 70% blockage, that time you feel the symptoms. Before 70%, usually it becomes asymptomatic. Patients may
Mm-hmm.
not experience pain, may not experience any other symptoms of heart disease. So once the blockage uh, goes beyond 70%, the patient starts experiencing chest pain. So number one is chest pain, or it might be uh, a chest pain while exertion, basically. So patient is trying to work something out, maybe walking up the stairs, down the stairs, or trying to lift something. At that particular moment, the patient might experience some pain. So pain,
Mm-hmm.
discomfort in the chest region. Then, in case of severe cases, it could be very severe chest pain with sweating, pain radiating to the left arm or the left neck region. So, and it could sometimes also be a very uh, palpitations kind of feeling where your heart is beating faster than normal,
Mm-hmm.
than the normal speed. So you might feel the palpitations or the fluctuations of the heartbeat. So these are in general signs and symptoms for heart disease.
Okay, okay, fine. And how do I rule out, doctor, that I'm having a chest pain? But I mean, a chest pain can be because of other reasons also, right? Like
Yes.
heart is just one of it. But what I understand is sometimes chest pain can be simply muscular also, or it could be simply some other reason also. Even an acidity nowadays presents with kind of a chest pain. People come thinking it's a heart, and finally it turns out to be a indigestion. So how you would like to say whether this is related to the heart or the cardiac origin, or is it a non-cardiac origin? How do we rule out this chest pain and acidity?
Okay. So I think this you should leave it to your doctor. Whenever you feel any kind of
Correct.
any yes, any kind of chest pain, please visit your nearest uh, emergency or urgent care facility. If not, at least your primary physician, if he or she is available. You come in contact. You don't try to come down to a diagnosis. What we can do is, uh, we could probably prepare for a better history. So try to understand what's happening with you. When is it happening? Is there any particular movement or a particular habit what you're doing in your day-to-day routine is causing you pain? Or whether it's your lifestyle thing, maybe after eating or after sleeping or after waking up. So just monitor yourself in case that is happening again and again. But my advice would be to definitely to reach out to your primary care physician or your urgent care facility immediately, because chest pain is a thing which you should not take it lightly. You should always reach the healthcare facility.
Perfect, doctor. That was a very valuable advice you gave to our viewers. It's really correct. Doctor, can children also develop heart ailments?
Yes, children can also develop heart ailments. So talking about heart ailments, it could not be the direct one. What we are talking about, cardiovascular disease immediately. Maybe the genetic
Okay.
cause, as we said, the hereditary part, which is playing a role. That could be a reason. But the other conditions which affects the heart, such as the rhythm of the heart. So there is something called the rhythm problems. We call it heart attack, or we call it arrhythmias. So these conditions can make you prone to basically stopping your heart. So heart blockage is what we call. So heart blockages can be in your basically in your blood vessels, which is supplying blood to the heart, or it could be the electric system or the conducting system. So it is the impulse which is causing the heart to beat. So basically, you
Okay.
can divide it into two types: the heart problem, the main problem, and the blood vessel problem. So if any heart problem, if you talk about, children can be prone, such as I said, the heart blockages and the cardiomyopathies are one of the cause, the familial cardiomyopathies. So there, your heart muscle is in at stake, so it is damaged. So that could also lead to certain heart ailments. So yes, to answer your question again, that children can also suffer from heart ailments.
Okay, okay. Thank you, doctor. If in case, we have a parent or an elder or child at home with this kind of heart ailments, what is the way in which, as common man, as common people, how do we take care of such heart patients at home? Especially, I think more elders will be there at home, with a
Mm,
CABG or with some other
mm,
heart ailment, maybe, and or a simple hypertension also for that matter,
mm,
uncontrolled
mm.
hypertension. So, doctor, how should we take care of such patients at home? Could you give some advice on that?
Yes. So talking about taking care of the people who are suffering from chronic illnesses is, first of all, is not easy. So I can understand, I can feel, because when I meet the relatives or even the patients, so patient is the one who is suffering from one end, and the family who is taking care of them is also uh, restless, because they want their loved ones to be healed. So it's basically a teamwork. So what I think is important is, first thing is to be involved with the patient care. So it's not only at home, but even at your clinics or at your hospitals, when your family member who is diseased is coming for a checkup or a follow-up, you please try to be involved in the care. Okay. So always make the feeling that you are involved, and what all steps and precautions have been decided at the clinic, we all go and try to follow it at the home. So it could be very simple things like remembering our loved ones to take the medicines on time, taking care about their food habits. For example, talking about hypertension. So the food habits comes in play. Cholesterol. So again, the food diet comes in play. Then obesity. So patients might be obese. These patients are very much prone to getting heart ailments. So again, controlling the weight. So all these aspects requires teamwork. So it's not only at the clinic what is happening, the medicine part is happening. It's also at the home, and even the caregiver, so the person who is taking care of the diseased person, should also approach the healthcare setup for their own problems, because what happens is when you care for others, you forget to care for yourself. So that should not be the case.
Yeah.
I would recommend that you come out, you speak it out, whether with your psychological counselor, your psychiatrist, or your primary care physician. The best one would be to start with your primary care physician and just be in loop, never to leave the loop. And express yourself, whatever you are facing and how you are dealing with it, because you also might need some help regarding taking care of the sick people.
Correct. That was really nice advice, doctor. What are the lifestyle modifications that prevent heart disease? What should it be? At least to
Uh,
start off, how do we approach this, ailment?
Yes. So it's always better, as it is said, prevention is better than cure. So it will always start with prevention. So if somebody is living a very good, healthy, uh, nutritious, more active life, they would definitely be at low risk. So it could be anything. I was reading a research article recently published by Mayo Clinic in the USA. So they have tried to figure it out some values. So these values are not so important, but it's just to understand that it's a step in understanding how we can prevent things. So they say that even 150 minutes of your total 1 week in a week, so 150 minutes in a week of any lightweight, or sorry, any light energy spending exercise. It could be a normal walking aerobic exercise, it could be a normal gardening, cleaning your house, cleaning your bedroom, whatever. But 150 minutes in total would be a good start in terms of talking about energy expenditure. And if you go via some people like gym, strenuous exercises, you could make it 75 minutes or at least two or more than two settings per week. So 75 minutes or minimum 75 minutes or 2 to 3 settings or 2 to 3 sessions in a week. That would be good to start. So this would be one part, that would be your energy expenditure part, exercise part, where you will be working over your extra fat development, weight gain, uh, then your maybe your activity level. So this is one part. The other part would be your diet. So in the diet, they say that you follow very low calorie, medium paced, green, leafy vegetables, fruits. Add more fruits to your diet. Consider having low fat meat, lean meat kind of thing, then low fat dairy products. All these things are dietary modifications. So the other part would be dietary modification. So I think with any known risk factor or any known unknown symptom, you're not facing anything, I would suggest you do whatever you're doing, but at a very normal level. You don't try to exaggerate, or you don't try to cut down on things. You go it slow. You know that maybe this week it was bad, I had too much of bad food, maybe fast food. You try to cut it down for the next week. You go slow. You don't try to change things abruptly, but keep a pace, keep a track. Okay, this is happening with me. Whenever I'm stressed, I'm eating a lot. Whenever I'm depressed, I'm not eating, I'm not having anything. It's not just depression, it's just maybe low mood. So just try to figure it out how your system works. So it is individual planning, it's for your own self. So individual paced planning about your own health is important in prevention. So it could be with yourself, and basically involving your dietitian or your nutritionist or your health trainer would be a good thing to start.
So, doctor, do like if a person has got a heart ailment, so is walking advisable or is jogging advisable, or are both advisable to a person, or is there any specification where people should opt any one of those?
Yes, that's a good question. And uh, talking about the advices what doctors give, I would just give a highlight on that. So it is actually person to person. So what kind of heart ailment you are suffering, that would be one of the major thing leading, and what kind of person you are, what kind of structure, function, what kind of work you do. So a lot of factors come into play. So it's not I've also experienced that two patients differently managed, same healthcare provider or the doctor, and they come that I was advised something different and my friend was said something different. So I don't know what is correct. So we don't have to go for correction. We just have to trust the physician or your healthcare provider, and just make sure what is best for you. So are you following the current whatever things which is advised? So considering in general, for any heart disease, walking is a good thing. for your what we are talking about, the cardiovascular. So you can, but you should not exert too much when you are
Mhm.
recently diagnosed. So it would be a very slow process. You would be advised to go in a very slow manner. Initial time after suffering from heart condition, you might be advised for a rest period with only your medicines and your homely activities being taken, being considered the major role. But as you proceed, slowly walking, it could be jogging later at the later stages. So it's a very slow and a process where everything is being considered. It's not the only one condition or one person. It is the general idea about the disease, about the person, and the best advice for that person.
Correct, correct. Thank you. And Doctor, there is a lot of discussion about the salt intake, the calcium intake. Salt, at
Hmm.
least we people know. I mean, almost people are
Hmm.
aware that if you have anything related to heart, reduce your salt intake. But about calcium, there is a lot of confusion whether you should take, you should avoid. Because if you avoid, then you turn up having weak bones, and if you take, then sometimes it is contradictory for your heart. I don't know. We are not sure about it, so we just wanted to know if you could tell us about the calcium intake in a heart patient.
Yes, it's again a very good question, I would say, and majority of the physicians and the specialists are currently working towards getting a very optimum level of the required supplements. So the entire this thing, calcium or the other supplements, whatever you talk, it comes under in general supplement topic. So as you said, first of all, calcium is good. It is required for the importance of calcium is quite mm, deep in our system. So it's required for the bone development, it's required for the blood vessels, it's required for the various processes to develop. So, but in excess, it is not good. So again, talking about females. So females in general, they have menopause. So they suffer basically a sense where their estrogen levels, which was taking care of the other things in their system, is being basically reduced slowly with age. So all these hormonal changes basically are making them more prone to bone diseases. So that's why it has become a trend currently that calcium supplementation, vitamin D supplementation should be given to these women. But what comes into play is when you personalize it, when you see your patient, the patient is consuming all the necessary diet. He's having good amount of calcium source, calcium rich foods. Patient, he or she is basically living a healthy lifestyle. There's no need of supplement. I would say you just try to measure it. Labs are available. You measure it. If needed, you give, because the extra amount of calcium is being deposited in your blood vessels, in your heart valves, or it is being accumulated in places where it shouldn't be. So that's why a slight increase in calcium or maybe a moderate to severe increase, it could be anything for any person, is basically linked to heart disease as well. So there are some studies which are coming up recently where too much of calcium is not good. So that's why supplements in general you should monitor and give. It's not that everyone needs supplements. So just make sure if you need it or not, find out with your provider, with your physician, your own research, your own trainer, and then take a decision whether it's required or not. If you're having a proper uh, versatile diet, proper nutritious diet, you don't need any supplements. And salt intake, as we said, we should cut down. So salt is not a good factor for heart. So salt restriction is better. So you don't have to completely cut down, but you should restrict it in your diet.
Correct. Thank you, doctor. That was really a very good input. And one last question, doctor. If suppose I identify that I'm having a heart attack, or one of my loved one at home or my neighbor is showing some signs of a heart attack, or it is just in process. So, what are the immediate action that we should be taking, or what is the first aid that you can do before you reach this person to the hospital? Obviously, that's the place where you should take him, but there
Hmm.
is a lot of time in between, wherein we need to be very careful when somebody has this problem cropping up. So could you please share some thought on this?
Correct, correct. So first thing would be our reaction to would be not to panic. Okay, first step in managing any emergency is not to panic, and it's easier said, but very difficult to be done. So
Yeah.
just we need to be very careful. It is a moment where you will panic, and you should. You are a human being. You don't like any other human being in pain. So I would say is you try to be not to get into panic situation. You try to just think what is happening. uh, Person is having heart disease, so we are focusing chest. So person might have hold his tightly to his heart. He might be in pain. He might not be able to speak as well. You are trying to ask him, but he might not be able to respond. So what you do is, first, in whatever state he is standing, sleeping, working, whatever, you try to make him at rest. You find a chair, or you find a very seat, whichever seat is available. You just make him rest in a seated position, and you just pat his back slowly. Okay, you just pat his back slowly, and you give a call. You give a call to your neighbor. If anybody family member is available, you give a call, because somebody should be there with him or the her. So you made the patient seated in a seated position, because it might be because of exertion. So as I said, one symptom would be chest pain due to exertion. So patient might be in some exertion mode. So you try to reduce the exertion immediately, make it in a seated position. You call for help. You can yell for help, and if somebody comes up, it's good. If not, you immediately grab your phone, call the ambulance meanwhile. Okay, you call the ambulance, be with the patient, pat the back. You don't have to give any medicine. You don't have to give any water. You don't have to intrude in any way. Okay, no CPR is needed at this moment. Patient is alert, conscious, so no need to supine the patient or make him in the sleeping position. Just wait and watch. It is the toughest thing to do, but the important part here is try to bring the patient immediately to emergency care setting. Why is because the only thing which would help is breaking that particular uh, blockage. So the dirt which is being accumulated, it needs to be broken down with medicine, which is given in the emergency setting. So your thing would be to reduce the amount of time from the patient is being in trouble to the patient is coming to the hospital. Okay. And in that sense, if the patient is conscious, patient would be mostly conscious in heart disease, except patient goes into heart arrest. So we are not talking currently about heart arrest. It would be the most severe complication of heart disease where there is heart arrest. The patient would be completely unconscious and he would not respond. In that moment, it's a CPR mode. That is a very different topic. But in general, we are talking about heart disease. So our job is to stabilize to rest the patient, give the seated position, call for help, and immediately reach to the healthcare setup nearby. That's the three I think major steps in considering towards a patient with heart disease.
So do we need to keep nitroglycerin with us, doctor? If you
Normal.
know that, uh,
So if the patient is already a heart patient, you have his medicine, pain medicines available, doctor has advised, you can give. But in case it's a first timer, you don't know anything about the medicine, or you don't have any available medicine, you are not supposed to give any medicine. You just have to make sure that the patient is rested. But in case you, as you said, there is nitroglycerin available or nitrate or any other painkiller which is available, you could go ahead with a painkiller, but only if you are confirmed that it's a heart patient and patient is being treated with a physician for a heart condition.
okay, okay.
Yes.
So that was really nice. I think we almost covered most of the common questions that would be there in people's mind. And I'm sure after listening to you, they might come up with new things also, for which we might have to call you back for another session and talk in detail. Because heart is a vast topic. As you said, cardiovascular, we just spoke about the
Hmm.
cardio part. The vascular is still remaining.
Thank you, Dr. Anuj Kakkad. It was wonderful having you here and talk on such sensitive topics. We would love to hear more from you in the future as well. Thank you so much.
Thank you very much, Team Unearth Wellbeing, to bring me here today and give me the opportunity to connect with your audience. I would encourage this kind of seminars or discussions where we can probably share some authentic medical information with the general population. It's a very good way to contribute to the healthcare factor. I also request the viewers to like, subscribe, and comment their channel to encourage them to keep them going for this kind of show. And also, if you have any queries or any doubts related to any medical conditions, you could probably revert to them, and they could probably come up with something and answer your queries. So, thank you very much again, and probably see you soon in some other session. Okay. Thank you.